to the cloud. And now we're going to do first exam. Where is my PowerPoint there? And I have a question. Can you see the PowerPoint?
Yes.
Did you see it move?
Yes.
Perfect. Thank you so much.
Mhm.
I'm using this triple screen thing, and I just want to make sure from the start we're doing it and you're seeing it as it moves. Okay. So there's a lot of chapters and it's a lot of information, and I know that. So there's growth and development. Always think about safety. Always think about immunizations, right? Infection control, and growth and development. That is the whole exam, basically. I just went through and did the exam, so I'm very familiar of what's going to be there. Now, there are a few theorists. I hope that you listened to my week 2. I think I described these extremely well, but I'm going to do it here for you again. So, when we talk about Erickson, it's that psychosocial, which means how does that child respond to the people around them? And how do those people respond to the child? And that's what this is all about, Erickson. So, an infant, what do they need from a person? They need, when they cry, somebody's going to come, pick them up, feed them, change them, burp them, whatever. So they trust that adult to come. Now, there are times when there is mistrust. And that's when, on a consistent basis, that they do not get picked up. This could be in drug abuse, alcoholism, any sort of homelessness. I mean, there are some occasions where, but it's all the time, and that is mistrust. As we get older into your toddlers, what do we know about toddlers? Automatically, me, mine, I do, right? So everything's mine. I want to do it. But what happens? The shame and doubt. That's mommy saying, be careful, don't do that. You're going to fall over. Let me tie your shoes. Let me do this for you. Let me do that. You need to let them do them themselves. That's the shame and doubt. They feel, well, if they're doing it, maybe I can't. So automatically, me, mine, I want to do it. But somebody, helicopter mom, grandma, aunt, uncle, whatever, is saying, no, let me do it for you. And that leads to the shame and doubt. That's toddlers. When we get up into your preschoolers, this is more initiative versus guilt. You know, they are getting more independent, they are getting more confident, and they try to do things. But we know it can't always be right. And that's the guilt. As simple as that. Now, the hardest one to understand, industry versus inferiority. I mean, what are these words? This is school age. What is school age all about? They are pleasers. They love to please adults. They love when they could do something well, they like to put that in the forefront. For instance, my industry is what I do, what my product, my factory, what I do the best. Could it be cooking? Could it be spelling? Could it be writing? Could be anything. That's my industry. I produce that well. But the inferiority is I can't do it all well. Now, there's questions that will ask you about school age children. Now, when you are having a long-term school age child in the hospital, let's say they're a bone marrow transplant for that's a long-term hospitalization. A school age children needs to be challenged. Let's say they need to do something, whether it's schoolwork or whether it's a puzzle or something we're having them do. We need it to be challenging, but we need for it to be obtainable so they don't feel inferior. So you need to challenge them, that industry, say, hey, I'm going to challenge you, but make sure it's not over their head. They can't do it. Okay. That's what that inferiority means. I can't do it all well. And that makes them feel bad. As we get into people and our surroundings on adolescence, we're talking about all about who am I as an adolescent? You're figuring out what is my identity. Remember, adolescents, they're too fat, too skinny, too many pimples, too curly hair, too many freckles, whatever. Nobody likes themselves as adolescent, right? So it's my identity. And it's not just the physical, it's who am I going to be when I grow up? Am I going to be a nurse? I always knew I was going to be a nurse. Are you going to be a lawyer? Are you going to be whatever? That is my identity. Okay, figuring out where I fit in, what I look like, what I want to be, and that's that role confusion. How do I fit in and how am I going to get there? So it's identity versus role confusion. Now, Freud, anything sex, anything sexual. When we talk about infants, it's about they soothe themselves in their mouth, okay? Give an infant who is freaking out, crying, give them, hold them, comfort, a pacifier. Little sugar water is the best thing for pain control on an infant because what do the children do? They explore the world through their mouths and it gives it comfort. So that's the first stage. Second stage is now potty training. What do we know about potty training? Bowels are trained before bladder. They can feel it, they can hold it better than their bladder, and that's why they say that. Phallic stage is the preschoolers. And again, it's just talking about boys get along with mommies better and girls get along with daddies better, or so they say, according to Freud. Latency, that's the weirdest word of all of it. It just means as school age children, usually their friends are same sex peers. Usually it's not a boy with a girl with a boy. It's usually two girls, two boys, groups of girls, groups of boys. They usually don't mix yet. And then, of course, we get to puberty and we get to adolescence, and it's all about the genitals and thinking about all the sexual things that go on. And now they're being attracted to whatever sex they want to be with, right? Holberg. You don't have to know all the names, but what these names mean. If you're an infant or a toddler, you don't have any morality. You don't know right and wrong yet. You haven't been taught. But when we get to preschoolers, what do they understand about right and wrong? They understand if I do something bad, I'm going to be punished. But if I do something good, somebody's going to say, oh my goodness, you're such a good girl. What a great job you did. Reward and punishment. That is all about Kohlberg. And remember, school age, they are pleasers. They like to please. They conform to rules. That's what they do. Now, there is questions regarding religion and other people's types of religions that we don't know about. So what do we need to know about this? Well, you never have to say, I agree with your religion. No, you have your own beliefs, your own faith, and just know who you are. But you must give that family that opportunity to be able to practice their religion, okay? You have to find out if there's certain things they need to do while they're in the hospital so that you can work around that. You also got to ask, there's sometimes about boys with boys and girls with girl nurses. They don't want a girl with a male nurse. So that's something you would have to, question about. And what about dietary restrictions? Some of them vegetarian, some of them don't eat meat, beef, some don't eat pig. I mean, you've got to figure out that's what faith is all about. Giving them the opportunity. You don't have to understand it or believe it, but you've got to give them the opportunity. And you have to remember there's differences in care, procedures, and diet. So we have to ask. Now, Piaget. Piaget is all about thinking. Let's think about this. At birth, a baby is born, and we have to spank their butt so they can take a deep breath. They didn't know how to do that before they went, and it was like, oh, a reflex, breathe, right? Then we put a nipple or a breast in their mouth, and what happens? They start sucking, swallowing, and breathing. Then what happens with their hands? A reflex. We grab something, right? So in the very, very beginning, We take small little things and we build upon them. Okay. Now, we start out with taking that rattle by a reflex, then getting it by voluntary, then moving it because it sounds good. These are all building upon just that reflex. Okay. And then eventually, of course, it goes in the mouth and I really like it. So Piaget's all about cognitive thinking. Are they developmentally where they should be? Because that's what Piaget's all about. Thinking. Remember, adolescents are the only group that can abstract think, which means they don't have to see it before. They don't have to have experienced it. They don't have to have that concrete type of thinking, okay? Concrete, you've seen it, touched it, felt it, so you can do it again. Abstract, only adolescents. They can fight their way out of a paper bag to get what they want because they know how to manipulate and think. And that's what abstract is all about. These are some more little things that talk about it. You can go through them and looking at different things on all of the ones. But I think I've hit with you some of the very big, good, important parts of your theorist. Now play. This is something we do from the moment we wake up to the moment we go to bed. We know we can unlook, we can play by ourselves solitary, and then the next three. This is very simple. Parallel plays, toddler, associatives, preschool, competitive, cooperative is going to be your school age. The difference. What about toddlers? Me, mine, I'm not sharing. Parallel. They play next to each other. They don't share at all. No, mine. That's toddlers. Ages up to age 3. When we become a preschooler and the play, 2 or more children playing together, but they're just playing together. There is no goal, there's no house built, there's no track built, there's no sandcastle, but no, they're just playing together. And then cooperative play, this is the one that you're going to build the house or the racetrack, or it is checkers. Somebody wins the game. There's a goal in the end. So those are the big 3 plays there. As I said, cultural differences, religious differences, it's the same type of thing. Again, make sure we know their preferences, caregivers, and giving them time for procedures and whatever they may need, and answering questions. And remember, if you need a translator, it must be the appropriate, not an older, teenage kid, their son. No, it has to be either the blue phone or somebody through the hospital. Okay, assessing kids, especially toddlers. I think those are the hardest ones that we have. Number one, get down and get on their developmental level, right? And you always start with the least to the most invasive. What would be a most invasive? Looking in the ears or the mouth or a blood pressure. I think those are the hardest for me. It's a squeeze, it's a hurt, but just listening to the chest and the belly and tickling their arms and pulses and look at their eyeballs. I mean, all of this is fun. This is play. Remember to let these children touch and play with the equipment if they're afraid. And those things do help. When you have a kid and let's say they come in with a broken arm, and the history that they're giving you and the parents are giving you are a little wonky. They don't match. Remember, your job as a nurse is to protect the child. That is reporting if we need to say, I don't know about this. Could you get your opinion? And you get the charge nurse, you get the doctor, the supervisor, whoever to go in and check about it if there's differences going on there. Okay. That's very important. Remember, with sexual abuse, it is a difficult thing for not only the child, but also the parent that brought that child in. If they're bringing them in to be cared for, can you imagine how much pain they're feeling that their child was abused in some manner or some way? And then the other one is mush housing. Bush housing is when someone, whether mother, father, aunt, uncle, grandmother, someone close to this child is doing things to get them sick, to keep them sick. I've seen things like injecting toilet water into IVs, having incisions open, putting dirt and things in them to keep them dirty and infected. What is our job if we suspect mush housing? Again, protect the child. So anytime that parent or suspected person comes in, somebody needs to be in that room with that child. And whatever they bring in, you must check. If they're bringing food in, it could be poisoned. It could have something in there to make them sick. So again, we need to check them. You don't have to have somebody in there all the time, only when that person comes in. So nutrition, right? So healthy diet. Nutrition is the most important thing about children. If you don't put gasoline in the tank, the car don't go. If you don't feed a child, cognitively, they're not going to be where they need to be. I think the one thing that I've always looked for at 5 months old, they should be able to roll from their belly to their back. That's the first way. And at 6 months, it's back to belly. So by 6 months old, they're rolling completely over. So if they're not, what would you say? Then we're going to go back and look, is the height and weight normal, right? Are they getting enough nutrition? And if that's yes, they are, then we have to go look, why is that child cognitively delayed, and early intervention, okay? Remember, any child, any age, from infant to adolescence, if they're overweight, underweight, parents are concerned what a child's eating. Are they eating enough? Because we know toddlers stop eating, right? They go down to what I call a physiologic anorexia. It's this much. I mean, hardly anything. And that's just what toddlers do normally. As long as they're cognitively fine, gaining weight, it's okay. They don't need the amount of calories they needed as an infant. I mean, they double their birth weight by 6 months, triple it by 1 year, okay? And remember, the first thing we're always going to look at is a diary. What did you eat yesterday all day? Tell me what you ate. That's the first way to start on that first day. And then send them home. Give me a week diary. Tell me what you're eating. And from there, they can make a decision what needs to be done for that child. That's weighing too much or not enough. There's two terms about this you need to know: overweight and obese. 85%, they consider it overweight. But if you're 95%, they consider that obese. Okay. And you can figure out a BMI, and no, you're not going to need that formula for the exam, but that's how it's done if you want to figure it out. You just need to know the differences between overweight and obese. So developmental assessments, we know that we do these because we can find, delays. There's all sorts of fundings, early intervention programs. I know Florida has a bunch of stuff in there, but all the states do. And again, they're there so that these children do get the physical therapy, occupational therapy, speech therapy. What do they need to get that child caught up? And I'll always say the best thing about kids, they are resilient. They get caught up pretty quick with the proper interventions. Heart sounds. It's another refresher for capstone next term because you're going to need it for your assessment when you do your sim. The aortic valve is on the right side, pulmonic is on the left, mitral is midclavicular, and tricuspid is on the right and left intercostal space, right around the sternal border. What do I want you to know about these valves and whatnot? Infants are the most difficult to listen to breath sounds and heart sounds. An infant is asleep in a mother's arms, daddy's arms, whoever, and they're calm. This is the time to listen to the heart sounds. Do they have a murmur? You'll be able to tell. Listen to breath sounds. Is it upper airway, or is it true and real rales or rhonchi? So again, it is those what I want you to know about heart sounds and where they are. Breath sounds. As I said, sometimes we have, breath sounds that are referred. So we have all this oral mucus. and it tends to gurgle. And kids don't like blowing their nose. So they have all these bubbles and they got all this gurgling, and their lungs are clear. But because of this, sounds, we think that they have rales and rhonchi. So if we listen to the upper airway, like the bronchiovascular, and then go down to the vascular, we know, is it upper airway mucus? We can either suction it or have the child blow their nose, and then listen to again, and then listen to the vesicular, which is all of the other breath sounds. Again, kids are hard to listen to because of all the mucus, and they don't like blowing. Now, there's a couple questions on your car seat here. Car seats, rear facing in the middle of the back seat. They can be rear facing till they're 2 years old or until the restrictions have been met by the car seat manufacturer. Usually 30 pounds and something tall is what they say, and then they can turn around. Remember, harness straps must be snug. Make sure they're good and tight. Also, blankets, those little receiving blankets, I roll them up on the young kids around them and tuck them in underneath, making sure they're nice and tight there. Okay. And again, these things, we keep them rear facing till they're 2 years old. So, infant, let's go into some key things about them. Well, do you know what a head lag is? So when you take the arms on a child laying on their back and you pull them up and their head falls back. Now, we know at birth, a baby has no control over muscles. The first muscle that they control is their neck, and that's usually by 3 months old. So if you pick them up and their head comes with them, 3, 4 months old, they're doing good. But let's say they're at 7 months and their head falls back when you pick them up. There's something neurologically wrong. This is something we would look at. That's a head lag. Okay. Again, we're going to put them on their backs to go to sleep. We know that. As I said, from abdomen to back starts at 5 months. Be careful nursing animals. This is when they will be moving. Okay. Again, they should be able to grasp their objects. Remember, it first starts as their reflex. I've seen it done at birth, but then it gets to be the point where they can voluntarily grab it. Everything in the mouth, we know it. Teeth, they say the earliest at 6 months. I usually see like four come up at 1 year, but again, 6 months minus how old they are will be how many teeth they are. So if they're 8 months old, they should have 2 teeth, is basically that. Remember, they're pulling themselves up to that creeping, like creeping around the couch and the coffee table by about 9 months and sitting unsupported, no pillows, just sitting there, 8 months old. And then steps, either walking or attempting. Colic is gas and it is uncomfortable, and babies get really mean and angry because you can't get rid of it. They say it's an infant who cries more than 3 hours a day, more than 3 days a week for more than 3 weeks. Now, it usually goes away by 3 to 4 months. But again, it's teaching parents how to rock and burp their baby well. Now, the one point from this slide I want you to know is don't assume that if a kid is crying all the time, it's colic. Well, he is. But what if it's something else, like intussusception, which we'll learn in week 8? Okay, what is it there? So again, if you ever are on triage or a phone call in doctor's office, whatever, infant, young, less than 3 months, we call infant, the really tender ones. If they're crying like that, they must be in to be checked, just to be sure. So developmental periods, there's a couple type of definitions. Sequential trend is basically a child is going to pick their head up and then they are going to use their hands that way. It's also motion. It's picking head up and rolling over and crawling and creeping and walking. That's all. Now, the pace is whatever that kid's going to do. They're on their own pages, but they're going forward in it. I've always said My last grandson has never crawled. The kid's 15 months old, is walking all over the place, is waddling, but he doesn't want to get on his knees that much and crawl. Again, moving forward, he's okay. And we know those sensitive periods are those little times where it's really good psychological sort of development that goes on with these kids. Now, those soft spots. We have the one here, which is called your anterior, and we have the one in the back called posterior. The one in the back should close somewhere between 2 to 4 months. If it doesn't close, there's a problem. If it closed too early, it's a problem. Just like the anterior, the one up here on the top of the head, that soft spot. By a year and a half, it should be closed. If it is not closed, what's going on? Is it hydrocephalus? Is a brain tumor? What's happening? What if it's closed at 6 months? The brain can't grow. Again, very important numbers you need to know. 2 to 4 and 12 to 18 months. And now pain. Pain will always be on every exam, every SE, every NCLEX. They love to talk about pain. So what is pain all about? Well, we know pain in children. What are we going to see in infants? They're crying, they're grimacing, their chin going. When they do that little chin going, that really kills me. And sometimes you see their arms and their legs going, and sometimes you see them not being able to move. They hurt so bad. So when we are evaluating pain, remember your pain scales. We have FLAC for infants up to age 3 and all nonverbal children. After 3, you can use flat faces forever. I mean, yes, numeric is there, we can use it, but we can use faces from 3 years and on. So making sure that we're doing that proper evaluation and remembering to go back to evaluate, did what you do work? I mean, remember, there are non-pharmacological interventions. It's positioning, hot packs, cold packs. What about a pacifier? For a pacifier, for a baby with a little sugar water on it, it works amazing. I've also seen parents, and it's sort of difficult, a little baby, trying to put a breast in their mouth and you're drawing blood or starting an IV, but I've seen it done. And the babies do very well at it. It's just working around the mother, trying to manipulate and get into position. Deaf. SIDS is something we've been studying for many, many, many years. I know since 1994 that I know of, we've been studying SIDS. We first said we could put them on their back and on their sides, and then we realized, no, the sides don't work either because they're still inhaling their CO2. So on their back to sleep. We found that the incidence of neonatal death first 1 year of life, 1 year. So after 1, the kids, quote, are safe. All right. So first 1 year. So no soft bedding, quilts, pillows. Don't sleep with your parents. Don't overheat them, overwrap them, too many clothes. Cigarette smoking will be a big deal, whether it's to prevent ear infections or to prevent SIDS death. We know prenatal care, if they don't have it, can cause it. And a recent viral infection, that means they got mucus in their nose. I mean, it's hard enough to suck, swallow, and breathe. Put mucus in there, now they really clog up. The young mother, prematures, and males have increased incidence of SIDS over the female. And if you breastfeed, it's better for the baby. Formula-fed babies have a higher incidence than breastfed do because breastfed parents or that mother is giving constant antigens, antibodies to that baby to prevent infection. So again, they have less incidence of SIDS. So here's some of the reflexes. Moro, startle. Clap your hands, bump in the crib, and the kid just startles. And it's great. Hands and feet both come up. We also have that rooting. When you take their cheek, they want to eat and they'll just go for it, right? Babinskis are in all age people, bottom of the feet. And then we know the grasp from voluntary to a reflex grasp, right? And to pinch your grasps. And those are those reflexes. Shoot, grasp, is when you turn a kid over to put them down in the crib on their tummy or on the floor, they put their hands and their feet out. Okay, and that sort of starts somewhere about 6 to 9 months. And you'll start seeing them. Before that, they don't know how to protect themselves like they're falling. It's like a cat, right? You throw a cat, their hands come out, protect themselves. Same thing with a baby. Pretty smart kids. Nutrition, the first 6 months of life is milk, only milk, which means breast milk or iron fortified formula. We know that babies lose weight and they start gaining weight. We know that they should be getting vitamin D if they're breastfed because they need it. They're not getting it with the formula, etc. And it's good for their growth. Second 6 months, we start introducing foods. It is one food at a time every 4 to 7 days before adding another food on because we're looking for allergies. It could be the first time they ate it or it could be the 10th time. We don't know. But again, looking for allergies. It could be as simple as a rash. It could be a little bit of type of rash, or it could be anaphylaxis. Whole milk should be given at 12 months old. We need whole milk. We need fat for the brain up to the age of 2. And that soy-based yogurt, they can be using that one at 6 months. Immunizations. So we know Hep B is first. We give that at the hospital. We know that there's all different types of vaccine that we give 2, 4, 6 months. We're just loading them up, right? Influenza vaccine. This is an interesting one. You know, we want to protect our kids from the seasonal flu, right? But we can't give it till they're 6 months old. And then what if we gave an influenza, this child gets influenza, and now this parent didn't know and gave him some aspirin? What do we know about that? Aspirin and virus together can equal Ray's syndrome. That's vomiting and it's that neurological change. That is one of our things that we are concerned about with parents with aspirin. Remember immunizations, we can do all different things to decrease the pain. We could put cold, we could put numbing creams, we can pump the legs after we give it. It is common to have a fever after immunizations because the body's making it ready to fight these infections. And of course, they're in the vastus lateralis. That's the picture out of your book. Here's some more pain, toddlers. So toddlers are ages 1 to 3. So we're going to be flack. So head circumference and chest circumference. This was a question that was off of an OB HESI that was, is the head bigger than the chest? And the answer is, how can the chest get out if the head doesn't make room for it? So the head at birth is bigger, but by about age 1, 15 months, they should be equal or their chest should be bigger. So toddlers. Toddlers are important with their food. Remember, I told you they stop eating. They almost, as I said, go physiologic anorexia. They don't eat hardly anything as compared to they, as infants, ate anything and everything that you gave them. And all of a sudden, they don't anymore. Okay. So you need to get good food choices, right? You can use food as a reward. Say, okay, if you eat all of that, you can have your, if they like apples, they can have the apples when they're done, or the grapes when they're done, or whatever it is that they do like, we can use it as a reward. Roasting vegetables are better than fried. Okay, very important. Also remember iron. Iron is always important to keep in these kids because they will go into anemia because of the amount of hardly any food they're eating to make sure milk, eggs, green leafy vegetables are in their diet, right? Help keep their iron level up. Also, if they're eating iron, they should have orange juice, just like taking the medicine, right? So orange juice, thinking about that. Makes sense. So toddlers, again, getting down on their level, assessing these children, always on their developmental age. And again, we start from hands to go to the feet, from least to most threatening, intrusive, and have mommy or whoever hold that child. Again, using play. This will help a child get through an assessment. Child in pain, a child who's sick, what do they look like? Well, a kid who's in pain is just going to be sitting in the corner. They're not going to be playing. They're not going to eat. If a kid is sick, in pain, the first thing you're going to notice, they're not hungry. They stop eating. Kids do. Adults will keep eating. We don't care. A kid, when they don't feel well or in pain, they stop eating. And that's usually your first clue. Let me check this kid. What's going on? Yes, if they're crying and can't be comforted, of course, we know we're going to check that. The flax scale, as I said, it's the face, the legs, activity, crying, consolability. And we know we're going to be giving them a point up to 10. We know it's 0 to 10 numeric, just like face is 0 to 10. So is flack. Okay? So we'll be giving them a number. Remember, it's just not giving them a number. Now we got to do something about it. We can give them medicine, yes, but kids, distraction, put on music, put on a movie, give them an iPad, give me a video game, give them something. Repositioning. How about a nice back massage on an older kid? They might want it, right? Again, when we are doing things to younger kids, and let's say we have to give medicines, they have an IV, use it. Because even oral stuff, they're just so over being in a hospital. So again, and if we do have to do things using, topical anesthetics for IV starts, even IM injections can make this hospital visit less threatening to these kids. As I said, toddlers, their growth and development, I want you to know that everything slows down, period, slows down. So nutrition, physiologic anorexia, right? They don't give juice, don't give snacks before they eat. That's the one thing they love to eat, juice, 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 right? Don't give it to them, and maybe then they'll eat more. We know toddlers are getting more active. They're getting more refined in their movement, more coordination. As I said, they're parallel play. Don't touch my stuff. This is my stuff, right? And now they're starting to learn how to take care of themselves, dressing, starting potty training, and all that good stuff. As I said, potty training, we know bowels come before bladder. That's just part of it. And there's the 3 signs of potty readiness. It's like they're feeling, they know I gotta go. They're starting to feel it there. And they're understanding now holding stuff. And 2 hours dry usually is telling you they can hold it. And we'll start giving them potty training times, okay? And again, are we going to give them a reward for PP potty? Of course, do something. So injury prevention. Toddlers are into everything, everything. Me, mine, mine. I'm going to find it. I'm going to put it in my mouth. So again, let's say they put mommy's, grandma's blood pressure pill in her mouth. Well, number one, immediately get help. Call poison control, get the help. Don't vomit them. Don't do anything. Call poison control first. That's always number one. Toddlers, how do you take care of all of this me, mine, mine, and this, behavior? They have temper tantrums. So the way they say to treat a toddler's temper tantrums are time out. 1 minute per year of age. Preschoolers, ages 3 up to about age 6. I know that I have every type of Band-Aid in this house for my grandchildren. They have a boo-boo, and a Band-Aid cures the world, especially SpongeBob and Spider-Man and Superman, right? A Band-Aid. If you don't put it on, they're going to bleed to death. So again, this is what preschoolers believe. Put a Band-Aid on, it's all gone. But again, their growth is really, 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 really slow. Okay, still, we're not going to grow fast. The fastest is your infants. That's the fastest thing that we go on. Again, They're eating a little better, but still it's not as much. They are now in the FACES scale, right? From 3 all the way up to 8. And then at 8, they say numeric, but I'm saying 3 can be for an adult if you want. It doesn't matter. And just, it's really, really amazing to me to see a 3 and 4-year-old. How much does that boo-boo hurt? And they point to a number 6. Now, an adult would point to a number 12, but a child is so to a 6. That's what they hurt. They're honest to a fault. They really are. What can they do? Well, as they get older, they're more and more coordinated, right? So at ages 3, they can walk, skip, and hop and walk backwards. By the time of 4 or 5, they're starting to jump more, standing on one foot. The biggest thing about preschoolers' safety is motor vehicles. Now, these kids are now mobile. They can move and they're quick. I have actually had 3 preschoolers get run over in driveways by cars. One didn't make it, one was sick, and one not a thing happened to. But again, because they're so mobile, they're on their tricycles and bicycles and scooters. Again, this is something that we have to be careful with. Gross motor skills, a 6-year-old can now ride a bike, jump a rope, and play hopscotch. They're extremely agile. And again, challenge the child with something that they can do, but something that they can achieve. Again, that's what that little red thing is there, talking Erickson. Never give them something they'll never be able to do. All you do is frustrate that child. Fine motor skills, look at what they do. Button shirts, blocks, pincers, thread things, color, cutting with scissors, all of this is being done. So, communicable diseases, chickenpox, you're going to see it. Chickenpox, we have a vaccine, but we still get chickenpox, even with the vaccine. So what are we going to see with chickenpox? Well, we're going to see vesicles and papules. This kid is sick. They're going to stop eating. They're going to have a fever, right? They're just not going to feel well at all. This is something that is a common thing, but it's highly contagious. When would you send a kid back to school after chickenpox? And the answer is after all the lesions are dried and crusted. Anything oozy and juicy, it's airborne, okay? It's airborne. So you do not want to have it in a hospital or back to schools because everybody possibly could get it. Child neglect. I've talked a little bit about it. Again, remember any neglect that you think, whether it's physical, educational, emotional, because I've seen all of them, okay, make sure that you report it properly. And again, it's the history and what the symptom is, the injury, they don't match. There's something going on there. So again, investigate it. Better safe than sorry. Nutrition in preschooler. These are the numbers you got to know. So, how many calories do a preschooler need? 1,200 to 1,400. They need some good protein, 13 to 19 grams, and calcium, 700 to 1,000. Again, up to preschooler, fat isn't as important. It's 2 and under. You need that more fat. Preschoolers, we don't even mention it anymore. Well, school-age children. School-age children are ages 6 to 12. These are children that are growing a lot. Their baby teeth all come out and all permanent teeth come in. So you're losing teeth the whole time through school age. Normal thing, right? And again, it's slow and steady growth. Injury prevention. Again, proper sports equipment. That was one of your discussion questions. Making sure they have proper injury protection. So they have helmets on or knee pads or elbow pads or whatever. ATVs are popular where I live. I live down south of Homestead in Homestead. I'm right by the Everglades, by Chrome Avenue. And I'm telling you, on any given day, you see 3, 4 ATVs going down the street. They shouldn't have children less than 16 years old on them. I'm telling you, there are, but there shouldn't be. They're not ready emotionally to handle in case of a problem. And if they're in the Everglades, they don't have any phone service. So again, they'd have to figure it out themselves. So under 16, no. Parent kids for any procedure. Again, you got to be on their level. School age children are 6 to 12. So you're from baby to almost an adult, right? So a 6-year-old, I'm going to tell them it's the camera to take a picture of your insides. On a 12-year-old, I'm going to say, oh, they're going to take an x-ray. We're going to look at your lungs. It'll be different things that we do say. School age disorders, ADHD is a big one. Again, this is inattention. This is hyperactivity. This is the inability to complete a task. One of the people that work a lot with ADHD are your school nurses. And the school nurses, if you ever decide that's where you want to be, it's like actually a great profession. And if you have kids, you're with your kids all the time. So it's a good thing. But this is one of the things that you'll be hit with. School nurses, ADHD. One of the things we think is that children with ADHD are just spoiled kids and they don't listen. That's not the case. They can't focus. They can't understand. They need help. So, as a nurse, listen to what the parents have done to try to help that kid first. Don't assume that they're done nothing and the kid's just spoiled, because that's what many nurses do. They did it to one of my best friends. So, I'm aware. So, depression, late school age, early adolescence, absolutely common. Kids go through a lot of emotion, distress, my identity, what I look like. Life is hard, it's rough. All of this is going on, right? Grandma is moving away, and my uncle, he's going without me, and, all this stuff. Anyway, so what is depression? Is a feeling of hopelessness and being sad. How would you know a kid was depressed? Well, you might see things as in they don't want to go out, they don't want to do anything. They want to eat or they want to eat too much, or they want to sleep or they don't want to sleep at all. All of these things. And if they even mention suicide, this is something to take seriously. And if they talk about a friend wanting to commit suicide, take it seriously, please. Dental health. They should brush their teeth twice a day, minimum, and they should floss. We know younger kids under like first grade and under, it's more difficult to floss. But after that, a kid should be able to floss. Remember, losing teeth is normal. They've got all their baby teeth that has to come out. So don't think that it's cavities falling out. It is their teeth. But these teeth can get cavities in them, the baby teeth, and that cavities can cause pain. I mentioned chickenpox, and I mentioned Ray's syndrome. Remember, Ray's is a viral infection. Usually they talk about influenza, seasonal flu, and linked to giving aspirin. And what would you see? And as I said, you're going to see that change in mentation, and you're going to see that vomiting, and that's usually the beginning of Ray's syndrome. Very, very sick kids. So now we're into adolescence. We're almost there. So, how do you open a conversation with an adolescent about their sexual history? Well, adolescents are rough. I'm an older woman, so I was always a threat. So I would always start with, so are you in sports? What do you want to be? Have you decided on college? Or I might see them listening to music. I'm like, oh, so what sort of music do you like? And I might know some of their music. Or they got neat sneakers on. And I know that they're the good ones. So I might say, oh, where'd you find them? I'm looking for them for my kid or whatever. Sometimes being human makes you less threatening. Okay. And then give them time to talk. You can have parents leave the room to talk to them. And then I'll ask you, can we give information to an adolescent about sex and birth control pills? And the answer is yes, we can. We can give oral and written information to them. That's our responsibility. And you don't have to tell the parents. Okay, they can come by themselves. Again, that's how you gain their trust. And again, same thing. Sexually transmitted diseases. HPV is one of the big things that's come into fruition, that we are now going to be getting 3-dose series HPV vaccines. It's males and females, and it's to prevent cervical cancer in women. We also have, the hepatitis one. Oh, adolescence and Erickson. Remember I said it's a sense of identity and role confusion. What am I going to be when I grow up? You know, One of the things that's difficult is your adolescence. It's adolescents and parents. They don't like each other. They're argumentative, and now you're in the middle. So again, sometimes you've got to tell parents, you've got to come to the middle. You've got to make some sort of pact with your kid instead of just fighting. Leading cause of death in adolescence, number one will be motor vehicles, and number two would be firearms, suicide. Nutrition. Now, why nutrition with adolescents? Well, adolescents tend to think they're overweight, or they're saving their lunch money because they want it for the weekend, right? So now you've got a kid who is not eating properly. So one of the things that we have to tell these adolescents is to make sure that they do eat properly. Grab a bottle of water and a power bar, and they go for the day. So whenever any child, especially adolescents, if there's a problem with nutrition, too much weight, too little weight, or whether you're diabetic with issues, how do we figure out what's going on? Get a diary, 24-hour diary, food diaries. Adolescents don't sleep. They're up with all the activities, they're on their phones, and they're doing all their schoolwork. And we know it's just part of being adolescents. We've already talked about depression. And then this is Tanner stages of development. The reason why I put it here is it's always on the HESI, always. And they're always going to say, what stage would it be? And it's like, how do you remember every single stage? It's a lot of information. So think of this. Stage 1 is you're a baby. Stage 5, you're grown up. The first thing that happens is breast buds and an enlarged scrotum. So you only have 2 stages that you need to choose from, 3 or 4. So again, you got a 50% chance now. Does that make sense to you? So menstruation, when does that start? 2 years after breast buds. That's the first stage. About 2 years later, you're going to see it. We know that adolescents do, because of this growth spurt that's going on, they are going to have irregular menstrual cycles because they're gaining weight and getting taller and going through all this puberty, and they're moody, and it's just absolutely normal. There's some dosage calculation stuff for you. If anybody needs help, you let me know. There's all your cahoots at the end of this too, if you need it. Anybody who needs extra help, just come to me, ask me, and I will be there to help. This will be first on my YouTube channel. So that is Professor Bogart, Pediatric Nursing. It goes there before your professors will have it. Okay? You go have a great evening and good luck.